Ever heard of the artist formerly known as Prince? If you do, you probably know about one of his most famous albums, Can the Purple Rain Save Us from COVID-19? We're going to come back and we're going to examine the use of ultraviolet light in the prevention and sanitation of surfaces and airborne particles with ultraviolet light. Purple rain, what does it mean for COVID and you? So, ultraviolet light for many years has been used to fight germs and to sanitize surfaces. But we have to be very careful because ultraviolet light comes in three flavors. And the most useful in terms of sanitizing surfaces is what is called ultraviolet light C. Now, ultraviolet light comes from the sun, and the harmful rays of ultraviolet light, which include UVC, are basically filtered out by the ozone layer as it comes into the Earth's atmosphere. But we have technology that can reproduce UVC light. And UVC light has been very useful to sanitize surfaces. The problem is it can be very damaging to the skin, it can be very damaging to the retina and to the eyes and to the cornea. So this is not light that is generally used in rooms where there are people present. So it can be used after hours when staff is gone from places, and you can shine ultraviolet light UVC onto certain surfaces, and it can be very useful in killing germs and other coronaviruses, not necessarily COVID-19, not necessarily SARS-CoV-2. Remember, SARS-CoV-2 is the virus that causes an illness called COVID-19. So we use these terms interchangeably, but I just wanted to be clear about the definition and use of the term SARS-CoV-2 and COVID-19. So sometimes you see commercial vehicles that say ultraviolet light to kill coronavirus, and kills 99.9% of germs, and so on. And these claims are in a way true, but they can be misleading. So what's going on with ultraviolet light type C and coronavirus? Well, we have studies, specifically one that came out in Nature Science in May of this year, that shows that ultraviolet light does kill coronaviruses. But there are hundreds, there's tons of coronaviruses. Just because it kills one coronavirus doesn't mean it's going to kill the coronavirus SARS-CoV-2 that causes the illness COVID-19. So there are some articles, there are some research studies showing that ultraviolet light type C can kill certain coronaviruses. Specifically, this particular article that I've mentioned that came out in May from Columbia University researchers shows that there are coronaviruses that are very similar to the one that causes COVID-19 that are killed in aerosolization chambers using ultraviolet light. Specifically, there's a new type of ultraviolet light that can be created in a lab and reproduced by certain labs, not UVC, but something called far UV light. And this is in a wavelength spectrum that is different than UVC, which is like in the 250 wavelength spectrum. This is all Chinese for most of our audience, but we define ultraviolet lights according to the wavelength spectrum from which it is created. Far UVC is different than normal UVC light, which is in the 250 wavelength spectrum. Far UV light is in the 222 wavelength spectrum. Now, that's not widely commercially available at this time. It's a product that is still in development. There may be some commercial providers out there, but you have to know what you're getting if you are trying to use ultraviolet light to fight COVID-19. So the researchers that I've already mentioned, what they did was they used aerosolization chambers. They aerosolized the coronavirus that they were investigating. It wasn't SARS-CoV-2, but very similarly related strains of coronavirus. And they showed that in an aerosolization chamber, 22 centimeters away from the light source, they effectively killed these coronavirus particles that were very similar to the coronavirus particles that cause COVID-19. Well, this is all inferential stuff that ultraviolet light, whether it's UVC or whether it's far UV light, that is of a very similar spectrum but a little bit different than UVC, can kill certain coronaviruses. Are we going to bet our life on using ultraviolet lights to disinfect surfaces based on data that has to do with similar coronaviruses in an aerosolized area? I would say that right now is a reach. Will this change? Will this change quickly? Will we have research that shows that far UV light, which is safer around people, will we show that can really kill the virus that causes COVID-19? We're not sure, but the research on this stuff is fast and furious. This can change at any moment. So the New York City Transit Authority is, after hours, when people are not in the buses, putting its buses in certain UV light chambers. And the idea is that they're going to sanitize the surfaces so that the surfaces do not carry the virus that causes COVID-19. This is all well-intentioned, probably very expensive, and probably premature. Is it easier to just wipe down touch surfaces with products that are approved for disinfection of SARS-CoV-2? That's probably a better idea. But, right now we're looking at all kinds of things to fight this virus, and ultraviolet light and purple rain, as I call it, is very appealing to some people because maybe there's a certain mystique about it, but the science has to back up the mystique. So why the purple rain idea? Well, these ultraviolet lights, especially UVC, when they are actually going, they emit this purple glow around the room. And it's very cool to look at because you think, well, the light is shining on all these surfaces, they're being disinfected. Well, we know it works for a lot of germs, but again, does it work specifically for SARS-CoV-2? It probably does, but we're not sure. And these types of apparatuses and lights and so on can be very expensive. Now, in the article that I mentioned by Brenner that uses far UV light, the light source from the virus was 22 centimeters. So just because you stick a big UV light into a room that may be shining 2 or 3 or 4 or maybe 10 feet away from an object, does it disinfect that from SARS-CoV-2? Well, we're not sure. And in fact, this is what the National Academy of Sciences had to say about this in April of this year. Here's a quote from the National Academy of Sciences from their website from Sciences and Engineering Medicine, from that segment of the National Academy of Sciences. It says, UVC, not far UV, but UVC light is used to disinfect objects and surfaces. So it says, ultraviolet light is produced by the sun and special lamps. There are 3 types of UV light: UVA, UVB, UVC. UVC light has the most energy of the 3 types, and this energy destroys the genetic material inside viruses and other microbes. Therefore, UVC light is used for disinfection. UVC lamps and robots are commonly used to sanitize water, objects such as laboratory equipment, and so forth. Now, here's their statement concerning SARS-CoV-2. UVC light probably, and I agree with that statement, probably destroys the novel coronavirus, that means SARS-CoV-2, but we need to learn more. Most UV sanitizers have not been tested against the novel coronavirus SARS-CoV-2, but UVC light has been shown to destroy related coronaviruses, including the one that causes MERS, Middle East Respiratory Syndrome. What does the CDC have to say about this? On July 28, they issue a statement called Cleaning and Disinfecting Your Facility. There are earlier versions of this statement, but here's what they say. The efficacy of alternative disinfecting methods. They've already talked about the approved disinfectants, the Clorox, the a number of Environmental Protection Agency disinfectants that are available against SARS-CoV-2 that we know work. By the way, if you're looking for the list, look for the N list. This is called the N list from the Environmental Protection Agency. And that's what the CDC and the FDA endorse as proper cleaning materials. So here's what it says. The efficacy of alternative disinfection methods, such as ultrasonic waves, high-intensity ultraviolet radiation, and LED blue light against COVID-19 virus is not known. EPA, the Environmental Protection Agency of the United States of America, does not routinely review the safety or efficacy of pesticidal devices such as UV lights, LED lights, or ultrasonic devices. Therefore, the EPA cannot confirm whether or under what circumstances such products might be effective against the spread of COVID-19. Essentially, it's an I don't know statement, kind of like that from the National Academy of Sciences. So, here's what I would say to folks. Avoid distractions. It's very nice to think that Purple Rain is going to solve our COVID disinfection problems. But more and more we are beginning to think that surfaces are not that important in the transmission of COVID-2. I'm not ready to give up my hand sanitizer, and I'm not ready to give up my bottle of Clorox yet. And I probably won't be ever in this epidemic. But remember, we really believe that this epidemic and this virus is spread by respiratory droplets. Remember your masking. It's extremely important. If you use an N95 mask, which is the only one that we know will protect the person who wears the mask, if you use this mask, be careful also with something we really haven't talked about, which is facial hair. If you have a beard, the beard should be in a certain way so that it doesn't interfere with the use of the mask. The CDC has a very nice little infographic about facial hair and wearing of respirators. This is a respirator by definition. The N95 mask is a respirator. So you might want to look at that. If you have a beard, make sure that it is very close and that you have a tight fit on your respirator and that you can do a proper fit test that we have discussed before on these videos. Folks, we don't have the magic bullet against SARS-CoV-2, against COVID-19 yet. Things are getting better in terms of our scientific knowledge. They're not getting better in terms of our numbers yet. So remember, the idea of cloth face masks and surgical masks have to do with other people wearing them to protect you. Do they really protect you? There is some anecdotal evidence that it does. We have some reports from Mortality and Morbidity Weekly reports that just came out in July showing some effectiveness of cloth coverings in prevention of droplet transmission. Theoretically, they work. But the idea is that people are using these masks to protect you. You are using these masks to protect them. Essentially, you are putting your health in the hands of the people who surround you. If you want to take your health and your COVID prevention into your own hands, this is what you're going to wear. The N95 or the KN95 mask, because it's the only one that we know will protect the person wearing the mask. Remember, you don't need any type of masking really if you're more than 6 feet away from people. If folks are hacking and coughing and stuff, just get away from them. You don't even need to be 12 feet close to those people unless you are properly prepared with an N95 mask. Maybe it's a family member, you're taking care of them. We can't just let people with COVID, go unattended. We got to take care of our friends and family who are sick. If you need N95 masks, they are widely available on the web. If you're one of our patients, they're available in our office. That's all we have today. We're going to come back next time and talk a little bit more about COVID. If you like us, you give us a thumbs up. Subscribe, folks. It's the only way that you're going to get this information on an ongoing basis. Remember, beware the purple rain. We're going to be with you next time right here.